Well, we would like to welcome you back to our series of podcasts sponsored by OBI Foundation. We have designed the series of podcasts to help you if you're new to the idea of bioesthetic dentistry, or if you've ever wondered what OBI is all about and what we teach, to have a little bit of an insight into the kinds of things that bioesthetics is all about. My name is Dr. David Maclean, and I've been involved in the foundation for close to 30 years. I'm currently Director of Education for the curriculum that we teach in 6 locations around the world. And I'm joined by Mr. Bernhard Egger, my partner in crime.
Thanks, David. My name is Bernhard Egger. I am a Master Dental Technician, originally stemming from Germany. And I'm glad and happy to join you on this podcast. And so we're looking forward to bring you certain topics that you probably never heard about before. And our approach is to create a different biomechanical understanding of the chewing system. Today, we will speak about biologic adaptation on the cellular level and its implication to biology or bioesthetic dentistry. Mm-hmm. And the very first question that I have for you, David, is, well, how would you actually really define cellular adaptation?
Well, that's a big question.
Yeah, I know.
I think maybe the best place to start would be with a textbook definition.
All right.
So I'm going to, if you don't mind, just read that. Defining cellular adaptation is either physiological or pathological. Cellular adaptation is a process by which cells respond and adjust to internal or external stimuli in order to maintain homeostasis, meaning stay alive and survive.
I didn't understand a single word that you were talking.
And just to add further confusion, these stimuli can be either natural, such as physical exercise or other factors that occur naturally, or they can be adverse, such as trauma, exposure to toxin, infection, etc. Mm-hmm. So what does that all really mean?
Yeah, really, explain that to my little German brain.
Yeah, well, I don't know if I can possibly squeeze much more in there.
Probably hopeless, but give it a
try. On a cellular level, we are evolved to adapt to varying circumstances in our environment. Mm-hmm. If we weren't able to adapt, we would perish and we wouldn't be here today.
Yeah.
So our cells have evolved to be able to adjust to changes in stimuli, and those things happen naturally in order for the cell to stay healthy and alive.
Okay.
Things like an adjustment of the genetic expression of the DNA, right, in order to compensate for a change in the environment,
right,
or an adjustment to the metabolism inside the cell, mm-hmm, in order to maintain production of energy, etc. Mm-hmm. So those kinds of adaptations are considered physiologic because they actually help the cell stay healthy and alive.
Okay.
If, however, the stimuli become too intense, so if there's a toxin or a mechanical trauma or anything like that, force, then sometimes those things exceed the cell's ability to adapt physiologically.
Right.
The cell will still adapt, but the changes that occur as a result of that stimulus do not lend themselves to that cell surviving. In other words, likely the cell will die. Mm-hmm. So that's on a cellular level.
Right.
And of course, we're all made up of cells, trillions of them, but those cells become differentiated as we are in the uterus becoming a human. Yeah. And so the cells will form various tissues, which we're all made up of, and mm-hmm, those tissues can be part of organ systems
Yeah.
or part of other systems that we would consider involving multiple tissues.
Mhm.
So how about taking a look at the chewing system?
Yeah.
That's made
Yeah.
up of, obviously, of cells,
Yeah.
of tissues, and of various types of tissues. So,
Well, and we discussed about is adaptation actually a normal or an improvement, expression of improvement of the function of a chewing system, or is it a pathologic process? And I guess that's where you headed, right?
well, I think we need to head there. I do. I think on a larger, sort of more long-range viewpoint, physiologic adaptation can be the result of changes in the environment that lead to evolutionary changes of that species.
Yeah.
And when we think about, okay, the vast variety of different life forms that we have on our planet, they are all differentiated because of adaptation to their environment.
Okay. And so, what kind of changes occur then in these mechanisms of cellular adaptation?
I think that in the cellular level, I better read the textbook definition first, saying the physiological adaptation involves controlled and reversible responses, such as modification of genetic expression, like we mentioned, adjustment of metabolism, remodeling of intracellular structure. I think where it kind of becomes critical is the difference in definition between physiologic and pathologic.
Yes.
And as I said, physiologic adaptation involves measured, reversible responses, such as those mentioned just now, modification of genetic expression, etc. Pathologic adaptation, on the other hand, involves irreversible or destructive, uncontrolled responses, and those do not support survival.
Now, are you suggesting that wear could possibly fall into that category?
Wear of teeth?
Yeah.
I think so. When we see someone that has worn teeth, that wear has occurred over a long period of time, and
dentin is exposed.
And as it progresses to a severe level, dentin is exposed, which leads to all kinds of other risks for pathology. So that adaptive process, when it gets to that level, I don't think too many people would disagree, is a pathologic adaptation. The question that maybe would be something that more people might argue over is at what point during that process of wear does that adaptation become pathologic from being a healthy adaptation, if you will, or physiologic. And so there's where the argument might come.
Well, I guess this is the biggest gray zone in dentistry.
I think it's the $1 million question.
Yeah, exactly.
Yeah.
So is there then a difference between physiological and pathological adaptation? And if so, how does it look like?
Well, if you're talking about the chewing system and wear and tear, I think that there's an argument to be made that any deviation from a natural, unchanged genetic form is pathologic. So that argument, if you follow it through, would say any amount of wear is a sign of pathology. There isn't any amount that would be considered physiologic. And we know that things that can occur as this process of wear and tear progresses get more and more serious. So as a result of the increased forces and workload that the system is having to bear up to, things like bone loss around the roots of the teeth that is important for the teeth to be supported, gums receding or gingival recession as it's referred to, and loss of tooth structure along the the gum line area, which is often referred to as abfraction, progresses as the teeth become more and more flat and worn. And then other signs and symptoms go beyond the actual mouth into the muscles that are involved in moving the jaw,
right,
the joints of the jaw,
yeah,
and even beyond that into the head and the neck.
Yeah,
Can develop symptoms.
Lots of different
discomfort.
tissues involved here.
Exactly. And those tissues are responding to a stress that we might say is overwork or overload.
Right. So
Yeah.
would you agree, David, that if I would say that, I mean, we got various disciplines within dentistry, right? So implantology, orthodontics, restorative dentistry, endodontology, sorry.
Endodontology.
Jesus Christ.
That's a tough one for a German.
It is, really. I mean, come on. Anyhow, thank you. So it seems to me like all these different findings and symptoms these various disciplines are dealing with have not been unified to that extent that we're looking at it from a biomechanical standpoint and ask, does forces and overload possibly actually induce all those negative effects? What's your take on that?
That's a really important question to raise, I think, Bert, because so much of what dentistry and the various disciplines that you've mentioned is focused on is, well, how do I fix the damage?
Yeah.
So, okay, here's an endodontist who's having to deal with a tooth that has died. Maybe it's infected. Well, we used to say, well, the reason that happens is that tooth decay got so deep that it infected the pulp or the center of the tooth and caused it to die.
Yeah.
Well, that's certainly one way that a tooth can die. But I think that anybody who's been in clinical practice for any length of time will have seen many examples of teeth that have died that are free of decay. There is no decay in a tooth, and yet the pulp is dead.
Yeah.
And so, okay, the endodontist's job is to remove that dead tissue and disinfect and fill and so on, so the tooth can be retained in the mouth. But the question that's being ignored, as you've just raised, is, well, why did it happen in the first place?
Yeah.
And we often talk in OBI about the three important questions that we need to address before we treat anybody. And one is, what is happening?
Yeah.
What are all the things going on? We need to know.
Yeah.
And the second one, why is it happening? And we need to be able to answer that question before we decide the answer to the third question, which is, what are we going to do about it? And in many cases where we see dentists of various disciplines having to deal with pathology, their focus is really on just patching it up, fixing the problem so the pain is gone or the infection is gone.
Yeah.
Or
so that's not unique to dentistry, I guess.
I don't think so. I think it's kind of widespread in medical science.
Right.
But I think we today are in a position to be able to really go deeper in our diagnostic process.
Yeah.
And answer, in many cases, why is this happening to this person? And if we can answer that, then we can be certain that any solution that we come up with is going to be one that works.
Yeah.
It's going to be functional, it's going to be stable, and it's going to last a long time.
Yeah. Would the term comprehensive probably match what you are trying to describe here?
Sure.
Yeah.
Yeah. A more of a global view, if you will, looking at more than just the tooth with the problem, but to say, okay, well, what's going on here as to why this has happened.
Yeah.
And I think, it's obviously more challenging, more daunting to be able to come up with answers to why is it happening. But in my view, that's the important thing to do before jumping into patching things up.
Right. Well, all those changes that you described that occur How do they actually relate to, I guess, observable changes related to the chewing system? Can you say something
Well, I think, yeah, we
about that?
encounter people at various stages of degeneration, if you
Yeah.
will. And it seems that some individuals have a genetic makeup where the most predominant obvious sign of a problem is tooth wear.
Yeah.
So if you think of they're made up of these various components, but in their case, the weakest link is the teeth.
Well, hold on. Do I understand you correctly? You're saying if tooth wear can be observed, this is a severe sign that something, so to speak, is going wrong here?
Absolutely.
Uh-huh.
And it would be an error to think that, oh, okay, here's a person with say 10% loss of tooth structure throughout their mouth.
Yeah.
That's where it's going to stop.
Yeah.
You've seen the history. It's pretty easy to predict the future. It's
Yeah.
going to keep going.
Yeah.
And in fact, as it progresses, it tends to become accelerated. So
Right.
that tooth wear gets worse more quickly as time goes by.
Mm-hmm.
And so for those individuals, the most obvious thing that you can first see is that.
Yeah.
But there are other people who have a different weak link in their system, if you will. So,
Right.
for instance, oftentimes we'll see people present with symptoms that are often described as temporomandibular dysfunction or
Mm-hmm.
pain in the face and the jaws.
Yeah.
And maybe a lot of those people don't show much evidence of tooth wear,
Yeah.
and yet their system is inhibited from functioning correctly.
Mhm.
It's definitely hurting.
Yeah.
And so as we address what's going on, what is happening for those people,
Mhm.
to try to find out the answer to the second question, why,
Yeah.
oftentimes it's the same reason
Mhm.
that those other people were having tooth wear.
Mm-hmm.
But it's showing up in a different pattern of symptoms.
Yeah. So I have the feeling that at some point, force in general is something that needs to be paid more attention to.
Yeah,
Yeah.
I think you're hitting the nail on the head there.
Mhm.
And so what would be the reason why somebody has excessive force or overloading forces
Yeah.
in their chewing system that are damaging the teeth, maybe,
Yeah.
or their.
Could you? Sorry, I didn't mean to interrupt you. I guess to make it even more clear, the term that I have in the back of my head right now, when you talk about that, is you mentioned prior the word stimuli.
Hmm.
So force is then equal stimuli. Can you just explain what the term stimuli actually refers to? What it means?
Stimuli could be like several different things that are occurring that upset the balance of the system.
Oh, okay.
So many times what we see is because of growth and development issues, there is a misalignment of some of the teeth,
Yeah.
typically at the very back of the mouth,
Yeah.
that is creating a stimulus of disharmony or unbalance.
Yeah.
That forces the system to adapt in a way that it can still continue to function, to chew
Mhm.
food.
Mm-hmm. So that would be the adaptation.
That's the adaptation.
Yeah.
The question is that adaptation physiologic,
Right.
or is it pathologic?
Yes.
And what we see is that it leads over time to symptoms and signs of wear and tear and overload.
Oh, I see.
So that one stimulus of something being out of whack, if you will,
Yeah.
in the balance of the system at the back of the mouth,
Yeah.
will lead to measurable, observable changes in the tooth shape because wear is progressing, starting at the front of the mouth, one side or the other.
Well, I can see that we would receive a lot of phone calls saying, "Hey, this is pure speculation. What are you guys talking about?"
Well, true, because a lot of people haven't really been educated on any of that, or they believe a different set of concepts. But I think that bioesthetics has been around for long enough that we've definitely seen vast amounts of evidence in the course of decades that this is actually true.
So if I can put it or I try to put it together, and you say, or correct me if I'm wrong in my understanding, but what I'm hearing from you is actually what we know is that overload leads to various negative consequences to the masticatory system. And if we look a little bit closer into that, what overload actually means, number one, and how we can sort of measure overload, we need to look at stuff like bone loss, maybe even already inflammation, gum recession. You named another factor that would be wear on teeth. And so these things, and I probably didn't actually name all of them, but these things are signs, not symptoms, signs of a periodontal overload. Is that correct?
Not just periodontal, but definitely the periodontal tissues are being overloaded in those cases.
Yeah, we didn't talk about the joints though.
But that, again, overload can lead to damage.
Right.
So yes, that word overload is a big one.
And so the bioesthetic approach would then be, according to those questions, refers basically take records of what we observe, and then we raise the question, what is the explanation for these findings? Mm-hmm. And so bioesthetic dentistry follows then strictly a certain path, which is not speculation, which is basically really proven, but proven in the sense that, yes, overload leads to bone loss. We're talking about forces, but if I hear you correctly, no one has so far within the dental discipline put all these singular factors together and make a comprehensive approach about what is going on or what is the reason. Is that correct?
Yeah, I think that's a pretty good summary of what
Mm-hmm.
we've just been talking about.
Mm-hmm.
And those issues, those signs that you refer to, can vary from one person to the next, depending on what their weaknesses are. But signs are often present well before symptoms arise.
Mm-hmm.
And I think, generally speaking, all the medical disciplines are focused on dealing with symptoms,
right,
and what can be done to make them disappear or go away.
Yeah.
Whereas a more comprehensive approach would be to say, I see these signs, whether or not symptoms have yet developed. Mm-hmm. We need to talk about maybe finding out why this is going on for you, and what could be done to prevent it from advancing further, and what could be done to restore you back to optimum health if you're interested in that. So that is a very different approach.
Well, I want to remind our audience that in our first episode, we were talking about a little bit of history of dentistry in general, right? And we were actually diving quite extensive into the matter that the biomechanical understanding that we're still applying onto our profession stems from a time that is more than 100 years ago, and that bioesthetic dentistry is actually an approach to use modern diagnostic technologies to understand the function of the masticatory system in a better way than we were capable 100 years ago. Would you agree?
Yes, absolutely. I think what we've done is we've looked back and said, oh, we made a mistake back then when these various parameters were decided that this was the best way to help somebody
Yeah.
based on maybe the way to make their dentures stay in place, as we talked about at the
right,
last episode. And somehow we're still thinking about those concepts when we are looking at somebody who has all their teeth, but has some problems. And I think it's important that we emphasize that we need to consider not just the structures that are typically considered part of the chewing system. If we're asking the question, why is this happening?
Yeah.
We also need to look at things like the cervical spine alignment, and has there been some deviation?
Yeah, we haven't talked about that yet. Yeah.
You know, that's another part of the question.
Yeah.
And another big one is, well, what is happening with that person's airway?
You say it.
And are they able to properly breathe, when they're sleeping, for instance? Or is that a factor in upsetting the balance and the harmony of their chewing system? And that might be leading to some of the signs that we're able to measure.
Okay.
So OBI, when it teaches the students in our curriculum, incorporates looking at all of those things to try to bring a whole picture of that individual into focus.
Well, David, we started our episode today on adaptation, right? So if I think about everything that we covered so far, and we spoke at a couple of times about wear. So, I mean, plain and simple, if something wears, then it means a change of form. Now, if we're talking about a change of form for the upper or maxillary teeth and the mandibular teeth, isn't it that we're also talking about a loss of so-called vertical dimension, and that loss of vertical dimension has an immediate impact on maybe airway?
Absolutely, a totally intimate connection there. Losing the vertical dimension, which we would define as the height of the lower third of the face, which is supported by the teeth, makes for less space inside the mouth for the tongue to live.
Okay.
And so the tongue has to go somewhere. It can't go forward, so it's going backward, which contributes to obstruction of the airway.
Reduced airway.
The tongue. Absolutely. There's that connection. So, we get back to this whole subject of wear.
Right.
I don't know of anything else that might show evidence of wear where somebody would say, oh, that's just normal adaptation. Like if the brake pads on my car are wearing, dude, change those pads or you're going to not be able to stop your vehicle. So why is it that we would look at wear in the chewing system and say, forget about it?
Well, I hear what you're saying. I would probably add to that one more time the, for me, critical aspect of force, because there is one evolutionary law, I guess you could say, and that is that any living creature, from an evolutionary standpoint, is the optimum adaptation to the minimum amount of wear necessary to perform a certain task. And we're talking about the chewing system. So actually, if I alter the form, applying a larger amount of force, then this would stimulate wear of hard tissue. In return, that wear of hard tissue would increase then the amount of bite force that is being applied on a constant level. In return, that would lead to, or could lead to, an overload of other hard tissues such as bone, and the loss of bone in return would then lead to loss of tooth or teeth, and other tissues such as cartilage or bone at the condyles, for example, could also experience damage. Can you tell us a little bit about that one?
Well, sure. I mean, we talk about adaptation being either physiologic or pathologic.
Right.
So if we upset the balance, and actually there has been research done on this very thing, Dr. Lee did some of it back in the 1960s, where he intentionally applied something on the biting surface of a back molar that had minimal thickness, but it was measurable.
Yeah.
And watched what happened to that person's chewing movements.
Right.
And how did they adapt to that interference or imbalance that he had temporarily introduced into their mouth. And he was able to measure and watch the changes.
Yes.
So that, of course, can happen as a result of many different factors. But those kinds of alterations in movement can lead to things like tooth wear, overloading forces.
Yes.
And those forces affect not just the teeth and the bone that supports them, but the joint of the jaw, because that's where the movement is happening. So there's a connective tissue disc or pad between the bones that can be displaced because the stresses from the muscles are too great. And then we have a situation where the bones themselves can start to degenerate. Now we have more recently, in the last 10 years or so, the ability to really accurately see that if it's happening with cone beam CT radiographies. In other words, three-dimensional radiography that has been developed to the point where we can ascertain whether or not this is happening or if there's a risk for it to happen. And that's all kind of wrapped up in this whole pathologic adaptation that we're referring to.
Yeah. I find it interesting that when I heard this, it's not new to me, but when I heard it the very first time, my idea was that, that would probably initiate a process that would take several years, if not decades. But what I learned was it is an immediate avoidance pattern that is being initiated by this experiment, and it could be repeated at any time. And so, if we take that artificial, what is it that we want to call it, interference away, and substitute that with a filling or an occlusal restoration, say any kind of dental restoration that provides some sort of interference. Actually, what we're looking at is an immediate avoidance pattern that settles in. So, correct me if I'm wrong, but I really want to put this to the edge. So what you're suggesting then is, even in a well-balanced or perfect, say, jaw relationship, all teeth healthy, everything is fine, and for some reasons I receive one occlusive filling or dental restoration, it could screw up, excuse my language, the entire chewing system?
Yes.
Is that
the answer to that is resounding yes.
Jeez.
In fact, even without a filling, maybe your dentist has decided that as a young teenager, you're at a bit higher risk for tooth decay, and they're going to apply this clear sealant on the biting surface of your tooth, which has a measurable thickness to it.
Whoa.
Dr. Lee, in his research that I was referring to, got down to as thin an interference as 8 microns. So that's 8
nothing.
1,000ths of a millimeter.
Okay.
You can't really even feel that between your fingers. And that induced that avoidance pattern in the chew.
Yeah.
So that adaptation happened immediately, but the effects that we can measure and observe in that person might take years to show up.
Yeah. And now that you say that and bring it up, I do recall that I read a research, a literature, which we can actually put into our show notes and link that into that, which actually refer exactly that and confirm exactly that. They measured the muscle activity on patients where they artificially created premature contact, and I think the thickness was 1/10 of a millimeter, and they measured the muscle activity, and as we discussed, it immediately was initiated, and after they removed it, it stopped. So a lot of people would probably refer to wear as, well, these people have a psychological problem.
Mm-hmm.
What do you think about that?
I think that's an easy, cheap explanation.
All right.
Your teeth are worn. You ground them off because you're a grinder.
Reduce
you're
your
too
stress
worked up.
level.
Yeah,
Yeah.
yeah. No, there's a physical component here. So the good news in what you've just described, though, is that if you take that interference away, then that change reverses itself.
Which, in return, correct me if I'm wrong, actually means that since chewing is a learned behavior, we can learn even if we adapt it to something, if we correct it to a new, better, more healthier pattern
of chewing.
That's interesting.
That reduces the work, the force.
The force.
Takes away the overload.
Well, so it is basically a process then that could be stopped, given that with the provided by the right diagnostic a treatment or approach.
Exactly.
That's promising.
It is promising, and for those of you that are kind of new to this, I guess the good news is that those diagnostic procedures and the interconnection of all these different things is what we teach in our curriculum at OBI, so that people will be able to answer those three questions with confidence. What's happening? Why is it happening? What to do about it?
Right. Thank you. Thanks. Wow. So that was really exciting, David. And I can tell you this, there's more excitement ahead.
There's more to come.
Because I just looked at our future episodes and found out that we're going to talk about what on earth is biomedical engiering and how does that relate to dentistry?
Yeah, that's a big one.
Come on. All right. But it doesn't stop there.
No.
We want to dive actually even deeper, and we will talk about topology and flow optimization.
Oh my goodness. Flow optimization.
Yeah. I mean, what is this all about?
Well, I'll tell you what.
Yeah.
That's a concept they don't teach in dental school, but it is important.
It is.
So we really do hope that you'll join us for our future episodes as we progress through our series.